Welcome to today's life-changing guide on the early signs of heart failure, a condition that affects over 6 million Americans each year. Your body might be whispering urgent warnings right now, subtle signals that could save your life if you listen closely. Too often, these signs are brushed off as aging, stress, or simply being out of shape. But the truth is, your heart could be crying out for help, and recognizing these signals early could make all the difference. In this comprehensive guide, we'll uncover 13 early signs of heart failure that are often ignored, from a surprising shortness of breath when bending over to tie your shoes to waking up at night gasping for air. By the end, you'll be empowered with the knowledge to spot these signs and take action before it's too late. Please note, this content is for informational purposes only and is not a substitute for professional medical advice. Always consult a healthcare provider if you suspect any health concerns. All information shared here is backed by verified research, with references available for further reading. Let's embark on this journey to protect your heart and transform your understanding of your health. Sign 1. Shortness of breath on activity. Let's start with a symptom that's easy to dismiss but could be your heart's first plea for attention: shortness of breath during everyday activities. This isn't about feeling winded after a vigorous workout. Imagine climbing a single flight of stairs or walking to your mailbox and suddenly feeling like you can't catch your breath. According to the American Heart Association, this condition, known as exertional dyspnea, is one of the earliest and most common signs of heart failure. What's happening inside your body? Your heart is struggling to pump enough oxygen-rich blood to meet your muscles' demands during physical activity. As a result, your lungs work overtime, leaving you breathless. Unlike normal fatigue, this symptom progresses over time. Tasks that were once effortless, like carrying groceries or gardening, start requiring breaks. Medical studies show this can appear months before more obvious signs of heart failure. Don't chalk it up to being out of shape. If routine activities now leave you gasping, it's time to listen to your heart. Sign 2, orthopnea. Next, let's talk about a subtle but critical sign: needing more pillows to breathe comfortably while sleeping. This condition, called orthopnea, sneaks up so gradually that many don't realize it's abnormal. You might start with one extra pillow, then two, and eventually find yourself sleeping upright in a recliner just to breathe. Research from leading cardiology centers indicates orthopnea affects about 80% of heart failure patients. Why does this happen? When you lie flat, gravity no longer helps your heart pump blood back from your legs and lower body. A weakened heart can't handle this, causing blood to back up in the pulmonary veins, which carry blood from your lungs to your heart. This backup forces fluid into your lungs, making breathing difficult. Many people dismiss this as a sleep preference, but if you've gone from sleeping flat to propping yourself up to breathe, your heart is sending a vital message. Sign 3, paroxysmal nocturnal dyspnea. Picture this: you're sound asleep, only to wake up suddenly, gasping for air, feeling like you're drowning. Your heart races, panic sets in, and you need to sit up or stand to catch your breath. This terrifying experience, called paroxysmal nocturnal dyspnea, is a serious red flag for heart failure. It typically strikes 2 to 4 hours after falling asleep, when fluid accumulated in your legs during the day redistributes to your lungs. Your compromised heart can't handle this sudden fluid surge, triggering acute shortness of breath. Clinical studies highlight this as one of the most alarming symptoms, often mistaken for nightmares, anxiety, or sleep apnea. Patients may rush to an open window, desperate for air. If these episodes are becoming more frequent, don't delay, seek medical evaluation immediately. This isn't just a bad dream, it's your heart begging for help. Sign 4, fatigue, and reduced exercise tolerance. One of the most overlooked signs of heart failure is overwhelming fatigue that makes daily tasks feel like climbing a mountain. This isn't the kind of tiredness that a good night's sleep can fix. It's a deep, persistent exhaustion that lingers despite rest, making activities you once loved, like a short walk or playing with your kids, feel impossible. When your heart can't pump efficiently, it prioritizes blood flow to vital organs like your heart and brain, leaving your muscles starved for oxygen. This leads to profound weakness and fatigue. Studies show this symptom can emerge months before other signs, with recovery times after activity growing longer. You might avoid tasks, make excuses, or blame age, but this gradual decline isn't normal. It's your heart struggling to meet your body's needs. Sign 5, ankle or leg swelling, peripheral edema. One of the most visible signs of heart failure is swelling in your ankles, feet, or legs, known as peripheral edema. This isn't the temporary puffiness from sitting too long, it's persistent swelling that worsens throughout the day. Research in cardiology journals shows this affects about 70% of heart failure patients at diagnosis. When your heart can't pump effectively, blood pools in your lower extremities, and reduced blood flow to your kidneys triggers sodium and water retention. This forces fluid into surrounding tissues, causing swelling that starts in the feet and ankles and may progress to the calves or thighs. You might notice socks leaving deep marks, shoes feeling tight by evening, or rings becoming snug. Unlike other causes, heart failure-related swelling is usually symmetrical and leaves an indentation when pressed. This is a clear sign to take seriously. Sign 6, rapid weight gain from fluid. One of the most measurable warning signs is rapid weight gain due to fluid retention. We're not talking about gradual weight gain from overeating. This is a sudden increase of 2 to 3 pounds in a single day or 5 pounds or more in a week, as noted by the American Heart Association. This should prompt an urgent call to your healthcare provider. Your failing heart triggers hormonal responses that cause your kidneys to hold on to salt and water, with each kilogram of weight gain representing about a liter of excess fluid. This can happen before swelling or shortness of breath becomes noticeable. Daily weighing is a powerful tool for early detection, as the scale often reveals trouble before other symptoms. If you notice consistent, rapid weight gain with bloating, your heart is sounding an alarm. Sign 7, nocturia, frequent nighttime urination. A puzzling but significant sign is needing to urinate frequently at night, a condition called nocturia. Many blame age or evening fluid intake, but it can be an early heart failure symptom. During the day, gravity causes fluid to pool in your lower extremities because your heart can't pump it back to your kidneys effectively. At night, when you lie down, this fluid redistributes, flooding your kidneys and increasing urine production. Research in cardiology journals notes nocturia as an early sign, sometimes appearing before swelling or shortness of breath. Patients may wake up 3 to 4 times a night, producing larger urine volumes. This pattern reflects your heart's struggle to manage fluid distribution, making it a critical clue. Sign 8, night cough or wheeze when lying down. A nagging dry cough or slight wheeze that appears only at night or when lying down is another subtle but serious sign. Unlike a cold or allergy cough, this one disrupts sleep and improves when you sit upright. It's caused by fluid buildup in your lungs when lying flat, triggering your body to cough to clear the airways. Medical literature describes this cough as worse in the early morning, sometimes with white or pink frothy mucus, a sign of fluid in the lungs. It's often mistaken for allergies or postnasal drip, but its nocturnal pattern, and relief upon sitting up, point to heart failure. Don't ignore this deceptive symptom. Sign 9, palpitations or irregular pulse. Your heart's rhythm can offer crucial warnings. Palpitations, feeling your heart flutter, pound, or skip beats, often accompany early heart failure as your heart strains to pump blood. You might feel your heart racing at rest or sense it doing somersaults in your chest. Research shows cardiac arrhythmias, like atrial fibrillation, are both a cause and consequence of heart failure, creating a dangerous cycle. These sensations are often more noticeable at rest or when lying down, sometimes paired with anxiety. While palpitations can have many causes, when combined with other symptoms, they demand medical attention. Your heart's irregular rhythm is a call to act. Sign 10, dizziness or near-fainting episodes. Dizziness, lightheadedness, or near-fainting episodes are frightening signs of heart failure. These occur when your weakened heart can't pump enough blood to your brain, especially during sudden movements or exertion. Normally, your body adjusts heart rate and blood vessel tone to maintain blood pressure, but a failing heart struggles, causing temporary drops in brain blood flow. Clinical studies note that syncope affects about 20% of heart failure patients and can appear early. These episodes, often triggered by standing quickly or mild exertion, are frequently blamed on dehydration or inner ear issues. But when paired with other symptoms, they signal a serious drop in cardiac output. Sign 11, abdominal bloating, poor appetite, or early fullness. Digestive symptoms like persistent bloating, loss of appetite, or feeling full after small meals might seem unrelated to your heart, but they're key early signs. Heart failure reduces blood flow to your digestive organs, and fluid buildup in your abdomen or liver causes congestion, leading to nausea, bloating, or discomfort in the upper right abdomen. Research shows these symptoms are often overlooked because they don't seem heart-related. Patients describe feeling full after a few bites or a constant pressure in their belly. These digestive issues, caused by your heart's struggle to circulate blood, can significantly impact your quality of life. Sign 12, bendopnea, shortness of breath when bending forward. Here's a lesser known but highly specific sign, bendopnea, or shortness of breath within 30 seconds of bending forward, like when tying your shoes or leaning over a sink. First described in 2014, this symptom reflects elevated heart pressures. Bending increases abdominal and chest pressure, overwhelming a struggling heart and triggering breathlessness. Studies show bendopnea affects about 30% of heart failure patients and is linked to advanced disease and higher mortality risk. Its specificity, rare in healthy individuals, makes it a powerful warning. If bending over leaves you gasping, your heart needs attention. Sign 13, cold hands or feet or narrow pulse pressure. Finally, changes in your extremities can signal heart failure. Persistently cold hands or feet, even in warm weather, or a bluish tinge to your fingernails or lips, indicate reduced circulation as your body prioritizes blood flow to vital organs. Narrow pulse pressure, a smaller than normal difference, less than 40 mmHg, between systolic and diastolic blood pressure, suggests reduced cardiac output. These circulatory changes develop gradually but are early clues of heart failure. If your extremities feel unusually cold or your blood pressure readings show a narrowing gap, your heart may not be pumping with enough force. Take charge of your heart. If any of these 13 signs resonate with you, don't panic, but don't ignore them either. Heart failure is a manageable condition when caught early, and modern medicine offers incredible tools, from medications to lifestyle changes, to slow or even reverse its progression. These symptoms often creep up slowly, making them easy to dismiss as aging or stress. But when multiple signs appear or familiar tasks become difficult, your heart is speaking loudly. Empower yourself by listening to your body and seeking medical advice promptly. Early detection can transform your quality of life and longevity. If this guide has opened your eyes to your heart's health, please share it with loved ones and type helpful in the comments to inspire more life-saving content. Like, share, and subscribe for more health insights. Thank you for taking charge of your heart, It's a blessing to prioritize your well-being.